clinician before I got into program management, and I can give an insight of one cases of a difficult labor which I had to handle myself. And this is a woman who is a multigravida. I think that was her 8th or 9th pregnancy, and it was really difficult for her. It was a prolonged labor, and she came in, the labor was difficult, she was so tired, and fortunately also the husband, it was a labor that started at night, and it was a small maternity unit which I had to drive a few 2-3 kilometers to go and attend when they came for me to come and see what can I do. And she was brought in there by the husband. So while she was there crying and languishing, she was not really delivering on time, the husband could hear the cry, and I was there, the nurses and the midwives were all there, and this man said, "Oh my God, here we are. I am not sleeping, the doctor is not sleeping, the nurses are all on their feet because of me, who is the cause of the trouble." So at the end of the day, we were able to get the mother delivered of a live baby. And there and then, the man, when I came out, said, "Congratulations, you've had your baby and the mother is okay." He said, "Now, doctor, before this woman gets out of this hospital, make sure you give her something that she will not get pregnant again, because I'm not ready to go through this ordeal again." And since she has delivered successfully, I had thought that my wife was going to die. I wouldn't want her to die if she has another pregnancy. So there and then he did that, and because she had that difficulty, we kept her a little bit, a few days in the hospital for her to recover properly. And before she left, she was offered the family planning service, and that she used, and she never had another baby because she felt, and he also felt, it's enough. And that one. So we gave them a more long-term method which they used, and they were happy, and the baby grew, and at least while I was there, the man would always come and say, "Thank you for saving my wife's life." And that was quite good, and I felt quite happy that at least he saw, because he was involved. We used this other model of training market women who, of course, they are not trained on the injectable methods, but they use the oral pills and condoms, because some of them are real businesswomen. They leave here at their homes as early as 5 a.m. to 6, and then they hardly come back until it is another 5, 6, 7 p.m. So most of their time, almost 8-10 hours, is spent in the market. So some of them are trained to keep these commodities with them in the market. And the market women who are around with them, we train them, and then we sensitize them to know if they need this, they can access it from their peer groups in the market there, without taking a lot of hours to go out and get those services at the facility level, because they don't have the time to wait. Facilities go out for outreach services as well. And because they go out for outreach services, it's usually an integrated service. Though they might be focused on one thing, but they provide all range of services. So a lot of the nurses and midwives go out for antenatals, and then as they go for the antenatal services, they go along with family planning commodities from other women who would come. And because it's also an avenue for child welfare clinics, they do weighing of the babies, and at the same time provide them with information about family planning, and some of them take the uptake during such outreach services. Some of the outreach services may be HIV/AIDS for HCT services, but it's also integrated with other services. And for creation of demand, some of the churches have also provided forum to meet women during their fellowship programs in the churches. So sometimes we use our nurses to give information about the advantages of family planning to the mother, to the baby, and to the family. And a lot of our pastors give room and opportunity for that, so that they know that those services are available and it is for their own good and for the good of the family. So churches give that opportunity for that to reach the men, to reach the women group, the youths, all different messages are given with different emphasis of support.